Shall I start? Okay. Good afternoon, everybody. Welcome to my presentations. First of all, thank you, Barry, for inviting me and for organizing this small OpenTox meeting. My name is Martin Smiesko, and I would like to start with the first topic, which is entitled Modeling Bioactive Conformations. I'm a Linux guy, I'm a molecular modeler, so that's why my presentation is in PDF format. I'm sorry for that. You will not see any presentations, any animations, because this is just PDF. It's hard to export anything from Linux to PowerPoint and vice versa. So let's start with a short introduction. What do I do? So I'm at the moment the group leader of a small molecular modeling group at the pharmaceutical department of University of Basel. So we follow the general strategy of helping with our computational methods anywhere where it needs interpretation, explanation, complementation, or completion of experiments, generating new ideas and theories. And we also try to deliver answers and do actually basic research. We have our own topics, which is first of all toxicity prediction, and on the toxicity prediction, off-target binding prediction, and we have also some activities when it comes to developing software and solutions and platforms for doing either drug design or toxicity predictions. We have also too many cooperations in oligosaccharides or natural compounds or newly human complement system, but I won't spend too much time on this because you will get the slides so you can read through later on. So let's focus on those things which we are focusing most. That's off-target binding, and here's a small introduction to the off-target problem. So I come from pharma environment, so it's always a little bit pharma focused. Obviously, pharma would like to be always on target and to hit with their drugs that they develop only the targets of interest. But this is often not the case, and the situation ends up like this. We actually do not hit what we want, but shoot next to our target. So in other words, our small molecules, our drugs, sometimes also hit unwanted targets, and this leads to the off-target toxicity and eventually adverse effects, and they can happen anywhere in here. So basically, small molecule will interact with biomolecules involved in biosynthesis, signal transduction, transport, storage, metabolism. So this is a very bright area, and we try to pick protein-mediated toxicity through well-defined receptors, not non-specific toxicity, but specific toxicity that works through certain receptors. Our view of the toxicity or off-target binding follows the same principle like the normal pharmacology. So if we have a small molecule here, dioxin molecule, which binds to the aryl hydrocarbon receptor, obviously if man or human being is healthy before there are no toxicity signs in the phase where the acute toxicity phase is there. When the compound is activating aryl hydrocarbon receptor, we have the acute phase with all the manifestation of toxicity. When the compound is washed out, when it's gone from the body, we return to the normal. So we think that the toxicology follows the same trends like normal pharmacology, and from that we see that the larger is the affinity of a compound, the higher is the toxicity class. So in other words, the more a compound binds, more strongly binds to the receptor, the worse toxic effects is going to be expected. So these are our basic views on this problematic. Why we jumped on this topic is basically explained here on this graph. 40% of the drug attrition is nowadays still caused by the preclinical toxicity. So non-clinical toxicity before even the compound that pharma companies are developing. This is actually statistics from AstraZeneca, Eli Lilly, GSK, and Pfizer. 40% of these compounds end up because they have non-clinical toxicology, and this is basically off-target binding. So the compounds do not only bind to where they should, they also bind somewhere else, and this is something which is really, really problematic. 40% is way too much. All compound groups and all target groups are affected by this thing, so there is no safe group, regardless of what is your target organ for your drug, regardless of what is the natural composition of the compound, whether it's an acid-base, neutral compound with sweeter ion, or whatever, regardless of whatever target you want to hit, it's always around 30% of failures because of toxicity, because of things binding to off targets. In September, I had the pleasure to participate in EuroTox, and there I spotted this slide, which I kindly reproduced. Actually, it's an answer from pharmaceutical industry, namely here UCB, Novartis, Pfizer, Allergan, and AstraZeneca to this problematic. So what do they want to do is, if you follow the classical drug development pipeline here, they suggest that hazard identification should happen as early as with the first hits. So right on, when you have the first hits known, you should start identifying potential liabilities, potential threats from your compound being bound to some off targets. Obviously, the best thing would be to do this experimentally, but yeah, it's expensive and it takes time and material and money. So we consider this to be an ideal situation for jumping in with in silico toxicology and in silico prediction methods. So we would like to help here or here with our in silico technology that could test the compounds of interest in silico and provide already early answers with much speed and hopefully also with enough accuracy. Since 2006, we've been developing a platform, virtual in silico platform for studying side effects or off-target binding. Traditionally, the receptors that we have in this off-target platform are nuclear receptors. This has to do with the fact that the initial stimulus came from the SNF, from the Swiss National Foundation, which supported QSAR, or basically in silico QSAR models development in order to predict problems with endocrine disruption in Switzerland. So we have receptors in our platform that are nuclear receptors, androgen receptor, estrogen receptor, thyroid, progesterone, PPR gamma, mineralo, liverix, glucocorticoid receptor. These are all nuclear receptors. We have also hERG as anti-target number one for pharma industry, so for the cardiotoxicity, and we have also 4 major cytochromes. So in other words, if you give us a small molecule, we can automatically evaluate its binding at these 16 off-targets, and we can tell you then how the off-target binding profile for this particular compound looks like. We also try to follow the searchable principles for developing QSAR models, of developing predictive methods. So we try to actually stick to these regulations, which I will now show you how the thing works. Basically, this is the user interface that you see. You can organize the compounds. Unfortunately, this is a static presentation. It was not covered before, but what I want to show here is basically you have a very simple Excel-like user interface where you see the name of the compounds, and color-coded you see the hits. So basically this compound binds to the glucocorticoid receptor with increased affinity. The darker the color, the larger is the complementarity of a small compound with the binding site, and the worse effects would be to expect. We don't only stick to the colors and numerical predictions. We provide our users also with the bioactive poses, and that's where the title comes. So we try to predict the bioactive poses of your compounds of interest at this particular target. Many of you probably recognize this is a cytochrome, so the heme, and this 5-membered ring, direct metal iron interaction, ligand iron interaction. So this compound would be a cytochrome inhibitor, and we do not only give you affinity for this compound, but we also show you the binding mode, which offers later on maybe repurposing or ideas how to protect this compound. So maybe if you would do substitution here with the methyl group, it would not access the iron and could be saved. So it offers mechanistic insights into the toxicity with option to save the project by having this structural mechanistic information. What is under the hood? Basically, we chained up a lot of own as well as commercial softwares in order to do steps that every computational chemist would do in order to evaluate the compound of interest. So we have the graphical interface installed at user side, and this is all installed in the user at our server. So basically, if we get the compound from the user, we do the first structural check. We check the protonation state of this compound. This is very important so that we know how the molecule should be modeled. We do the conformational search in order to identify the reasonable conformations. We calculate partial charges for electrostatic interactions, solvation energy, as to compare how it would interact with water. And then we use molecular docking in order to find the bioactive poses. And as soon as we have this information, we can score the compound, so to calculate how much is it worth in delta G. And we provide this information on all 16 receptors to the user, and he or she can then judge himself or herself what it would mean. So we basically calculate the binding mode and the binding affinity for every single compound. Interesting point about the toxicity prediction is that we have done an analysis of 800 drug-like molecules which are stored in PDB, and we have found out that majority of small molecules, when they bind to the macromolecular targets, are bound in a low energy conformation. So these blue and red columns actually show us the area where conformers from conformational search superimpose perfectly or compare perfectly with the binding pose, with the bound conformation within the RMSD of 1 angstrom. So that's why I show you the blue and the red columns. And this shows us that if we do conformational search and find low energy states of a small molecule, very likely among these conformers there will be a conformer which will fit into the off target, which will fit into the receptor. And that's what we do with software Dolina, which I wrote for this purpose. So it's a simple docking program which takes the conformers identified based on this fact, what we did, and inserts them based on the pharmacophore approach with inspiration in the template protein complex to the binding site. And it looks for matching solution and generates first poses by rotations and translations and bump checking. Then it also does induced fit, and this is also quite a strong point about Dolina, that it features combinatorial side chain rearrangement algorithm. So we really search for for a good solution of the induced fit effects, and as soon as we have it, we do the scoring and provide top ligand protein complexes to the user. So that's our approach. And if everything works fine, it might look like this. So here you see a comparison of experimental pose and the one which we calculated using our tools. So you see a very nice superposition for this mycotoxin alpha-zearalenol at estrogen receptor alpha. This is all compared on experimental data. And you see RMSD, so the comparison of the atoms is very good. Below 1 angstrom, it's actually considered perfect. And you also see the hydrogen bonding network, and all the interactions are very well, nicely identified. As soon as we have the pose, we calculate delta G based on a thermodynamic cycle, hopefully parameterizing all of these energies properly with best accuracy that we can allow. And at the end, we compare what was the energy before protein and ligand was bound and after it's bound. So this is our score. The larger is the delta G, the worse should be the outcome, the more toxic could be the compound. Here are a few highlights. So we have quite some users and quite some compounds processed every year. So we also are recommended by the guidelines from European Union. So we are happy that they kind of recognize our software to be useful for endocrine disruption. We have few cosmetic and food companies using our software, and also Federal Swiss Food Safety and Veterinary Office uses our software for doing predictions. And this is our latest poster from Eurotox. We not only do docking, but we also do MD analysis of the binding mode. So here it was again a video, and unfortunately now it's static. But in MD simulations, we basically within time try to look whether these interactions, whether the binding mode and the binding pose are stable, and this gives us additional insights into how the compounds bind. So it's not only static docking, but also molecular dynamics. And molecular dynamics give us then additional insights in how long particular interactions persist within the binding mode, and we can then learn more from these graphs how stable or how feasible our predictions are. We move also molecular dynamics to cytochromes, to studying cytochrome liabilities, and this is a relatively new part. We try to now construct full membrane cytochrome complexes, and here green, again, it was a simulation. We can see acetaminophen, paracetamol interacting with the membrane, and then it was sneaking through a tunnel inside to the binding site. So this is additional information, additional accuracy, which gives us access to many different properties that we can learn from these MD simulations. So obviously, we know we have too little targets, so our future development and priorities would be to enlarge our portfolio, get as much receptors as possible, superpolymorphism, and maybe also move to allosteric binding sites and complex, larger proteins in order to explain some further aspects of toxicology. We would like to also work on faster and more accurate methods with GPU acceleration, with providing our own software solution. So really go to the best. In summary, we know that preclinical toxicology is a large problem. We try to offer a solution which is in silico platform for testing a large amount of receptors for single molecules. And we also hope that we will then contribute to explaining maybe on the first principles of target binding, and to explain mechanistically what we see, and hope to contribute to safer drugs, or in the worst case, one could repurpose molecules. If we see that they are binding at certain receptors, we can use it to develop other drugs. Acknowledgement. Professor Angelo Vedani, my former boss, who actually is the father of the idea of Virtual Tox Lab, Max Dobler, who programmed the graphical applications, so the viewer for the poses, my PhD students, and obviously our financing partners. If you would like to learn a little more about me, please follow the ORCID link here in this slide. Thank you for your attention.
Thank you, Martin.